Okay, let's unpack this. Welcome to the deep dive. Today we are plunging headfirst into the fascinating, pretty intricate world of the nervous system.
It really is the body's control center, isn't it? Manages absolutely everything you think, feel, and do. Our source material today is, well, it's a pretty comprehensive look at structure, function, what happens when things go sideways.
Yeah, and our mission here is to take all that dense info, pull out the really crucial bits, and make them, understandable and hopefully memorable for you. Think of it like a quick start guide.
Your fast track through the neural network, maybe? Without getting totally lost in the jargon, we'll be your guides.
Exactly, highlighting the essentials from the source. So where do we even begin with something this massive? The source actually gives us a pretty good starting point, breaking it down right away.
Yep, two main divisions, the central nervous system, CNS, and the peripheral nervous system, PNS.
I always think of the CNS as like the main headquarters, the command center. It's just the brain and the spinal cord, the big shots.
Totally. And the PNS is, well, it's everything else. That huge network of nerves spreading out to literally every part of your body. It's how HQ talks to the field operatives and how they report back.
Right. And the source breaks down the PNS functionally too, doesn't it?
It does. You've got the autonomic nervous system first.
Yeah.
This is your body's autopilot. Handles all the stuff you don't consciously control, like heart rate, digestion, breathing, gland regulation too, all involuntary.
Okay, the automatic stuff. And the other one?
That's the somatic nervous system. This is the voluntary side. It's what you use when you, say, decide to wiggle your fingers. Controls muscle movement, and it also brings info in from the outside, eyes, ears, skin sensors.
Gotcha. So if the CNS is HQ, the PNS is the whole field operation. The autonomic guys are like the building maintenance crew, keeping everything running in the background, lights on, systems go.
Yeah, automatically.
And the somatic team are the field agents, gathering intel that's the sensory input, and the action teams carrying out specific orders, like muscle movements. Makes sense. One decides, the other does or reports.
That works. It really shows that functional split. Okay, so let's zoom in on the CEO of that command center, the brain itself. The source outlines three main parts.
Right. The biggest chunk is the cerebrum. That's like the main processor, right?
Pretty much. Then you got the second largest part, the cerebellum.
Ah, yes, the cerebellum. The source mentions its key job, doesn't it? Something about balance.
Exactly. It coordinates your skeletal muscles to maintain balance and posture. Super critical.
I picture it like the body's own internal choreographer, constantly making micro adjustments so you don't fall over. Or maybe like a super sensitive gyroscope.
Yeah, those are great visuals for it. And finally, connecting the big cerebrum to the spinal cord, you've got the brainstem.
And the brainstem itself has parts. The midbrain, the pons, and the medulla. These bits are like absolutely vital, controlling basic life support. Breathing, heart rate, stuff you really don't want to think about.
Definitely not. Which kind of leads us to the less fun part, the fact that this amazing system can have problems. Let's maybe shift gears and talk about some issues the source covers, starting with CNS infections.
Okay. Yeah, the source lists quite a few: meningitis, encephalitis, brain abscess, even collections of pus like subdural and epidural empyema and osteomyelitis of the skull. It's a scary list.
It is. And what's really interesting, or maybe alarming, is how these infections actually get to the brain and spinal cord. The source points out some common routes.
Like spreading from nearby infections.
Exactly. From places like your middle ear, sinuses, even your respiratory tract. Or they can travel through the bloodstream from infections somewhere else entirely in your body.
Wow. So like a really bad sinus infection could potentially lead to something way more serious in your brain if it spreads.
Precisely. Meningitis, for example, that's inflammation of the meninges, those protective membranes we mentioned, often caused by bacteria or viruses that spread just like that. And the source highlights the bacterial kind as often being the most serious.
Okay. And encephalitis, that sounds similar.
It's inflammation of the actual brain tissue itself, usually viral. And yeah, symptoms can range from just a mild headache to, well, really severe brain dysfunction, seizures, even coma. The source even mentions herpes simplex virus causing a particularly nasty sudden form.
Yikes. What about brain abscesses?
Those are basically pockets of pus inside the brain tissue. Often they result from chronic infections nearby again, think sinuses, or those mastoid air cells behind the ear. Or sometimes systemic infections like pneumonia can seed an abscess.
And those empyemas, subdural and epidural.
Right, those are pus collections too, but they're located just outside or just inside the dura, that tough outer membrane covering the brain. And again, often linked to spread from nearby infections, sinuses, mastoids, or maybe complications from head trauma or surgery.
It seems like proximity is a big factor, things being close to the brain.
It really is.
Yeah?
Even osteomyelitis of the skull, that's infection in the skull bone itself, is usually caused by spread from nearby sinuses or maybe the scalp. It really hammers home how interconnected everything in the head and neck is with the CNS.
So the big takeaway here isn't necessarily memorizing all the names, right? It's understanding how infections can breach the CNS, either spreading directly from nearby spots like sinuses or traveling through the blood. And that leads to inflammation or these dangerous collections of pus.
Exactly right. Okay, moving on from infections. The source also delves into CNS tumors.
Ah, yes, another major category. The source lists things like glioma, meningioma, acoustic neuroma, pituitary adenoma, and then others like craniopharyngioma, pineal tumors, chordoma, and metastatic carcinoma. Quite a list.
It is. And a key distinction the source makes right away is between primary tumors, those starting in the brain, and metastatic tumors, which are cancers that spread to the brain from somewhere else.
Right, and gliomas are mentioned as the most common primary malignant ones, the bad ones starting in the brain.
Correct. They arise from glial cells, the brain's support cells. And the source notes they tend to spread kind of aggressively through the brain tissue itself.
Okay, but then there are meningiomas. They sound less scary.
Well, they're described as benign tumors originating from the meninges, those protective membranes.
Okay.
So not cancerous in the same way. But, even a benign tumor can cause serious problems depending on its size and where it's growing just by pressing on things.
Makes sense. Location, location, location. What about pituitary adenomas?
Those pop up in the pituitary gland right at the base of the brain. The source says many are benign too, but they cause trouble, either by getting big enough to press on nearby structures like the optic nerves, affecting vision, or by actually secreting too much of certain hormones.
So they can mess with your hormones too.
Yeah. And then there's metastatic carcinoma. That's actually super common cancer spreading to the brain. The source points out lung and breast cancer are really frequent culprits, usually spreading via the bloodstream.
So the key insight here isn't just rattling off names. It's about understanding the difference between tumors starting in the brain versus those arriving from elsewhere. And the basic idea of aggressive ones like gliomas versus often slower growing ones like meningiomas, and how where they are causes the specific problem.
Precisely. It's about origin and behavior.
Mm-hmm.
Okay, let's shift gears again, completely away from disease processes now, and talk about physical injuries, traumatic processes.
Yeah, trauma. The source covers a lot here too. Skull fractures, obviously, but also different kinds of bleeding inside the head, epidural hematoma, subdural hematoma, intracerebral hematoma, subarachnoid hemorrhage, plus injuries to arteries and facial bones.
Yeah, and an important point the source makes about skull fractures is kind of counterintuitive. Just because you have one or don't have one doesn't automatically tell you if there's serious damage inside the skull.
Ah, okay. So the fracture itself isn't the whole story.
Not at all. Which is why emergency CT scans are the standard for head trauma now, not just plain x-rays. You need to see inside.
Makes sense. And those different types of bleeding hematomas, they look different on the CT scan, right?
They really do. An epidural hematoma that's usually from faster arterial bleeding, often the middle meningeal artery gets torn. It typically shows up as this biconvex, like lens shape, pushing in on the brain from the skull.
Okay, lens shape, got it. What about subdural?
Subdural hematomas are usually from slower venous bleeding. They tend to spread out more, taking on a crescent shape that follows the curve of the brain's surface right under the skull. So think lens versus crescent.
Lens versus crescent. Okay, that helps visualize it. Then there's cerebral contusion. That sounds like a bruise.
It basically is injury to the brain tissue itself because it bumps against the rough inside surfaces of the skull during trauma. On CT, you might see areas of swelling, maybe some little pinpoint bleeds mixed in.
And intracerebral hematoma.
That's a collection of blood within the brain tissue itself, like a bigger bleed directly into the brain parenchyma.
Okay. And subarachnoid hemorrhage. We heard that term before.
We did. In trauma, it means bleeding into the space around the brain where the cerebrospinal fluid normally flows. On a CT, you'll see blood outlining the brain's folds and crevices. These patterns are crucial clues for doctors.
Yeah, it's like different kinds of damage leave unique fingerprints on the scan. The source also briefly mentions carotid artery injury, usually from penetrating neck trauma like stabbings or gunshot wounds and various facial fractures. Apparently, nasal bones break the most often.
Yep, they're out there and pretty fragile. It all just highlights how vulnerable the head and neck region is to impact. Okay, let's move now to conditions affecting the blood vessels within the CNS vascular diseases.
Right, and the big one here has to be stroke, right? Stroke syndrome. The source defines it as a sudden dramatic loss of brain function because blood flow got interrupted.
Exactly. And the symptoms totally depend on which brain area loses its blood supply. It can be devastating.
But the source also talks about something called transient ischemic attacks, TIAs. What are those?
TIAs. Super important. Think of them as mini strokes or warning strokes. They're temporary episodes of neurologic deficit, like sudden weakness or speech difficulty, but they resolve completely, usually within minutes or hours. Definitely within 24 hours.
Okay, temporary. So why are they so critical?
Because, and this is huge from the source, almost 2/3 of major strokes are preceded by TIAs. They're a massive warning sign that something is wrong with blood flow, indicating a very high risk of a full-blown, possibly disabling stroke coming soon.
Wow, 2/3. Okay, so a TIA is like the universe sending you a serious heads-up message.
Pretty much. They're often caused by tiny clots or blockages, frequently from plaque buildup in arteries outside the brain, like the carotid arteries in your neck. Finding and treating the cause of TIAs is vital stroke prevention.
So maybe like a stroke is a total power outage in a part of the brain, and a TIA is like the lights flickering badly, a major warning before the blackout.
That's a perfect analogy. Captures the temporary warning nature. The source also mentions intraparenchymal hemorrhage again here, bleeding into the brain as a type of hemorrhagic stroke, often linked to high blood pressure, weakening blood vessels over time.
And subarachnoid hemorrhage, too. The main cause here is different, though, right? Not trauma.
Right. When we talk about it as a vascular disease, the primary cause is usually a ruptured berry aneurysm, a weak spot ballooning out on a brain artery. So bleeding can happen from injury or from diseased vessels. Different causes, similar dangerous outcome.
Got it. Okay, let's switch gears slightly. What about multiple sclerosis, MS?
Right, MS. The source calls it the most common demyelinating disorder.
Demyelinating. Okay, break that down. Myelin is the...
Myelin is the fatty sheath, the insulation, that wraps around nerve fibers. It helps signals travel quickly and efficiently. Demyelination means that insulation gets damaged or destroyed.
Okay, so it messes up the signals, like faulty wiring. If the insulation on an electrical wire is damaged, the signal gets weak or shorts out.
Exactly like that. It disrupts nerve communication. And MS typically presents with these recurring attacks, these relapses of neurologic symptoms. It often affects the spinal cord, the optic nerves behind the eyes, and the white matter deep inside the brain.
And the source says it often starts in young adulthood, more often in women.
That's the typical pattern, yes. And the course is usually marked by these periods of relapse, followed by periods of remission, though the specifics vary a lot.
How do they usually diagnose it?
MRI is really the key. It's great at showing those scattered patches or plaques where demyelination has occurred in the white matter. It's basically an inflammatory process where the body's own immune system seems to attack the myelin, but it happens unpredictably over time.
So the core problem in MS is that signal disruption due to damaged nerve insulation.
Got it. Okay, next up, epilepsy and convulsive disorders.
Right. Epilepsy is basically a condition defined by recurrent seizures. And seizures happen when there's a temporary abnormal burst of electrical activity in the brain, like a sudden electrical storm.
And the symptoms can vary a lot, can't they? Hugely. From just brief moments of zoning out or losing consciousness for a few seconds, all the way to, well, violent convulsions, shaking, falling, the works. It really depends on which part of the brain that electrical disturbance hits.
And what causes it? The source mentioned it's often idiopathic, meaning no known cause.
Yeah, in many cases, the cause isn't clear. But it can be triggered by things like a head injury, problems during birth, or sometimes infections.
And the source describes two main types.
Petit mal, that's generally a milder form, often seen in kids, characterized by those brief episodes of just staring blankly, maybe some slight muscle twitching, often disappears by adulthood.
Okay, petit mal is the milder one.
And then there's grand mal. That involves the more dramatic, generalized convulsions, the shaking, loss of consciousness, sometimes loss of bladder control that people often picture when they hear the word seizure.
Okay, fam, quick pop quiz from the source then. Which type of epilepsy is the milder form often seen in kiddos?
That would be the petit mal.
Nice. So epilepsy boils down to those brain electrical signals going haywire temporarily. Okay, good summary. Now let's transition to diseases that cause a progressive breakdown of the nervous system, the degenerative diseases.
Yeah, this is a tough category. The source lists several important ones. Normal aging itself, Alzheimer's disease, Huntington's disease, Parkinson's disease, cerebellar atrophy, and ALS, amyotrophic lateral sclerosis.
It's interesting the source includes normal aging. There's some decline even then.
Well, yes. The source notes that even with normal aging, there's a gradual loss of neurons over time. On brain scans, this can show up as the fluid-filled spaces, the ventricles, and sulci looking a bit larger.
Okay, but Alzheimer's is different, more severe.
Right. Alzheimer's is described as a diffuse progressive atrophy, a shrinking of the brain tissue, specifically the cerebrum, that develops much earlier than you'd expect from just normal aging. Scans show similar features, like enlarged ventricles and prominent sulci, but often more pronounced or earlier.
And Huntington's disease.
Yeah.
That one's genetic, right?
Yes, it's inherited, autosomal dominant. It typically shows up in early to middle adulthood and involves progressive dementia, plus those characteristic involuntary jerky movements. The source mentions the key pathologic feature is atrophy, or wasting away, of specific deep brain structures called the caudate nucleus and putamen, which you can often see on CT or MRI.
Okay, then Parkinson's disease. That's the shaking palsy.
Exactly. Another progressive degenerative disease, usually starting later in life. It's characterized by symptoms like a stooped posture, stiffness, slowness of movement, often a mask-like facial expression, and that typical rhythmic tremor, especially in the limbs when they're at rest.
Different symptoms, different affected brain area, but still that progressive loss. What about cerebellar atrophy?
That's degeneration specifically focused on the cerebellum, the part we talked about earlier being crucial for balance and coordination. The source says this can be inherited, part of another degenerative disease, or sometimes caused by the toxic effects of chronic alcohol use or certain medications like phenytoin.
And ALS, Lou Gehrig's disease.
Yeah, ALS, that's a particularly devastating one. It involves the selective loss of motor nerve cells, the ones controlling muscles, leading to progressive weakness, paralysis, and eventually difficulties with breathing and swallowing. So the running theme with all these degenerative diseases is that progressive loss of specific groups of nerve cells or brain regions. It's like critical parts of a complex machine slowly wearing out or breaking down over time, and the symptoms reflect whichever part is failing.
Yeah, like a building slowly crumbling, a sobering thought, but it clarifies the process. Okay, we also need to cover hydrocephalus quickly.
Right, hydrocephalus literally means water on the brain. It's a dilatation and enlargement or swelling of the ventricles, those fluid-filled spaces inside the brain, usually associated with increased pressure in the head.
And the source mentioned two main types.
Yes, non-communicating or obstructive hydrocephalus. That's where the normal flow of the cerebrospinal fluid, the CSF, gets blocked somewhere along its usual pathway, like a dam in a river, causing a backup upstream.
Okay, a blockage. And the other type?
Communicating hydrocephalus. In this case, the CSF can still flow out of the ventricles okay, but it's not getting absorbed properly back into the bloodstream in the space surrounding the brain.
Ah, so the fluid gets out of the main chambers but can't drain away properly afterward?
Exactly. So thinking about it like plumbing, non-communicating is like a clog in the pipe itself, causing pressure buildup behind it. Communicating is like the pipe is clear, but the main drain it flows into is blocked or overwhelmed, so the fluid still backs up.
That plumbing analogy really helps visualize that.
Okay.
Almost there. Lastly, the source briefly mentions sinusitis. Seems a bit different.
It is, but it ties back. Sinusitis is inflammation of the sinuses, those air-filled cavities in the skull. Usually starts with a viral cold, blocks drainage, causes pain, pressure, fever.
And how does it connect to the nervous system stuff?
Well, remember how we talked about infections spreading from the sinuses to cause meningitis or brain abscesses? That's the key link. Sinusitis itself isn't a CNS disease, but its proximity and potential to spread make it relevant. The source mentions the maxillary sinuses are most often involved, and radiographically, you look for fluid levels or thickened sinus linings.
Right, that potential for spread. Okay, wow. We have covered a lot of ground here.
We really have, from the basic architecture, CNS, PNS, brain parts, to all sorts of problems. Infections spreading in surprising ways, different kinds of tumors, the impact of trauma and how we see it on scans, vascular crises like stroke, and those crucial TIA warnings.
Plus specific conditions like MS affecting nerve signals, epilepsy with its electrical storms, the slow decline in degenerative diseases like Alzheimer's and Parkinson's, the fluid backup in hydrocephalus, and even how sinusitis connects.
It's definitely a complex system. Hopefully breaking it down based on the source material has made the key concepts clear for you.
Yeah, absolutely. Okay. And for that quick memory trick for the main divisions, CNS is the command enter structure, brain and spinal cord, that's your HQ.
And PNS.
Peripheral network system, everything else, all the branches reaching out.
Nice. I like it.
So wrapping this up, what's the big picture? It really just highlights how incredibly complex, absolutely vital, and yet, honestly, quite vulnerable our nervous system is. Everything we are relies on it.
Yeah, and thinking about all these different problems, infections, tumors, trauma, vascular issues, degeneration, it shows how many different ways this intricate system can be challenged. It underscores the importance of understanding these processes.
Definitely. So, listening to all this, what stands out most to you? Is it how easily an infection might potentially spread to the brain from somewhere seemingly minor? Or the way different injuries leave unique visual clues on scans? Maybe the critical importance of recognizing a TIA as a warning? Or perhaps just the sheer complexity revealed by conditions like MS or the slow fading and degenerative diseases?
It really does make you appreciate the incredible, delicate machinery we have running the show inside our heads every single second. Lots to think about.